Live from Utah's first TV station, ABC4 Utah. News at 4 starts now.
All right, thanks, Dan. We take a lot of extra precautions to stay healthy during the winter, but one thing we don't talk about very often is our feet. With tips on how to take care of them when it gets cold outside is Dr. Jason Bruse, a podiatrist with the Ogden Clinic. Thanks for being here today.
Thank you.
So is it true, the mantra that two things you should spend money on, mattress and shoes? Is that true?
I think it's probably true. It would probably lead to a lot fewer patients if everyone followed that.
So we think about our feet more kind of in the summertime, getting them in the beaches or just doing things outside. Why think about them as well in the winter?
In the wintertime, people generally will wear warmer shoes and closed shoes. And closed shoes oftentimes, especially for women, tends to accentuate a lot of the problems that they would have in their feet. Bunions and neuromas oftentimes can be really worsened in the wintertime because you're wearing a closed shoe all the time.
I'm sure a lot of people are thinking, yes, it's wintertime, I can hide my toe fungus, I can hide the bunions in my boots, but this isn't something you should keep avoiding.
Well, my philosophy is that you should go see someone whenever you have a problem that is preventing you from doing something. And so I find myself a lot of times even talking patients out of treatment or talking them out of surgery. You only want to have something done if the problem you're having, if the pain you're having in your foot is preventing you from doing things that you like to do. A lot of problems are fixable, but you only want to go through the trouble if it's really interfering with your life. So,
what about plantar fasciitis? We hear a lot about that as well.
That's the #1 reason that someone comes to see me in my office. I see 10 patients at least a day that have that. It's a very common problem that happens to athletes, to non-athletes, to people who just work out, weekend warriors. It happens really to basically every walk of life. It doesn't. And it's a very common problem where it's an irritation or a tearing of a very important ligament in the arch of your foot. It usually tears by your heel bone, and it can be a very debilitating problem for people, but it's very treatable.
Very treatable. Okay, so you said you need to come in and talk to a podiatrist like yourself if it's something that persists or affects your everyday life.
Sure, that's what I tell patients all the time. If the problem you're having is if it's interfering with the things you like to do, hiking or skiing or running or going to walk the dog, if you can't do those things anymore because your foot is hurting, well then go see somebody, because it is a lot of times those problems are correctable, and then you can get back to your life and back to doing the things you want to do.
So you don't have to suffer forever. There's hope out there.
There is, yes.
And so are there things that people can do at home to kind of mitigate some of those issues, some of the pain?
Sure. It depends on the different problems, but in the wintertime we tell people to make sure that shoes have plenty of room. Everyone's always wearing closed shoes in the wintertime, or they're wearing boots, and make sure that there's plenty of room in your shoes or your boots in the wintertime. Especially in the cold weather, a lot of people will wear extra socks or 3 layers of socks, and that can be problematic sometimes. I've had cold injuries or mild frostbite from people getting too crowded within their boots. And so one rule of thumb is make sure if you're wearing cold weather shoes or boots that your toes can wiggle around inside, because that allows circulation to get down there. Same is true in ski boots. A lot of people will tighten up those ski boots too tight, and then they'll complain that their feet get cold, or they'll wear too many layers of socks and their feet get cold. You're actually better wearing thinner socks that give your feet some room for circulation.
A little wiggle room for your Piggly Wigglies, right? Your little toes.
Exactly.
Well, Dr. Bruse, thanks for joining us today. We'll put all that information on our website at goodforutah.com. You can also head over to ogdenclinic.com for more details as well.